So for decades, we have created this culture essentially of immobility among our kids because we're worried that children are going to remove their endotracheal tubes or lose their vascular access lines. And because of a concern of safety, we end up over-sedating these children. The problem with this is that prolonged levels of immobility, as we know well from the adult literature, can really change outcomes in terms of prolonged mechanical ventilation, increased exposure to opioids and benzodiazepines, and all of these things can lead to prolonged hospital stays. The PICU Up program was born out of an observed need to change our culture in the pediatric ICU. So when we started the program and started conceiving the program, we noticed that we were universally over-sedating our patients, that children were often being discharged from the PICU on medications like methadone and Valium, and that we were not screening for or preventing delirium. So in order to optimize this culture of early mobilization, we took lessons from our adult colleagues and started meeting on a weekly basis to determine what the barriers and facilitators were in our own pediatric intensive care unit. And this was a multidisciplinary collaborative team composed of one champion from every discipline that would be needed to make this program successful. So over a period of 1 year, we developed the PICU Up program based on our specific barriers and facilitators and move forward into the implementation phase and developing the program based on tiered criteria for these critically ill patients. Keeping children awake and alert during the day and optimizing their sleep at night can only improve their ability to communicate and be lucid and interactive with us. And I think it's important to note that even for children who aren't doing well or who may not leave the intensive care unit or unfortunately may pass away, having those last moments where they were communicative with their family can be priceless for these families' experiences at the end of life. A PICU Up is an interdisciplinary multi-component program that incorporates all of the elements of the ABCDF bundle in terms of improving outcomes for critically ill children. We want to make sure that we manage and treat pain, that we optimize mechanical ventilation, optimize sleep-wake cycles, prevent and treat delirium when it's present, and obviously mobilize children as soon as possible, and taking into account that early mobilization is a broad spectrum of activities, and starting that early can really improve outcomes for our patients. We've found that our team is much more satisfied with the approach to how we care for these children on a day-to-day basis because they're able to communicate with their patients, especially the older patients who can communicate using specific communication devices even when they're intubated. Families love the program because they're able to interact with their child and see them awake and alert during the day and comfortable. And also it helps to watch their children exercise and be active during the day during a very long hospital stay that can be very stressful. One of the important aspects of the PICU Up program are the e-learning modules. It's very important for the entire staff, intensivists and therapists and nurses to all have a shared mental model. So we provide you with an educational module about early mobilization in addition to a module about delirium screening and prevention strategies. The second component of the PICU Up program that's very important is the train the trainer opportunities. So these are opportunities for us to discuss specific barriers and facilitators within your unit to enable us to help implement the program to a culture of mobility in the pediatric ICU where you are. Finally, we have opportunities for consulting where we can have one-on-one discussions about specific challenges to early mobilization in the pediatric intensive care unit and how we can optimize outcomes there. We know that paradigms are shifting in critical care across the world. Our adult colleagues have demonstrated that ICU liberation, keeping patients awake and alert during the day and optimizing activity, can improve outcomes unequivocally in a short and a long-term basis. Early mobilization is a cultural commitment. It's a cultural change that needs to occur to improve outcomes and quality of life for our patients and does not require a large financial investment for your institution. It's really a team-based approach and putting in the work up front to change the culture of mobility in your pediatric intensive care unit.